Hi, my name is Kelsey Bromeling, and today I will be demonstrating the horse health check. My horse's name is Rudy, and my handler is Missy Belkey. We do these horse health checks to assess the health and care of our horse to prevent and solve problems. The types of health checks that we have are the general appearance and behavior, our temperature, our pulse, our heart rate, our respiratory rate, our mucous membranes, our capillary refill time, skin pliability, gut sounds, and digital pulse. With the general appearance and behavior, we need to know what is normal and regular for your horse, such as the attitude, the energy, their eating and drinking habits, the skin and coat condition, and their stall habits as well. Unless it is common for your horse to be lethargic, sweating, pacing, anxious, off feed, or not drinking, none of that should be, or anything else that is out of the ordinary. You also need to consider the weather, their exercise, the diet change, and the stress level as well. Along with general appearance, we also need to take in feces and urine into consideration, as they are good indicators for your horse's health. With the urine, it should be clear, whitish to yellow to a light brown. If it is red, it could indicate blood or azotoria, also known as tying up. For the feces, it should be tan to yellow to dark green. The consistency should be firm and round. They should produce 28 to 50 pounds a day, occurring 8 to 10 times a day. If it is too hard, that could mean dehydration or lack of exercise, or if it is too loose, it could indicate digestive tract problems. The first horse health check I'm going to demonstrate is a mucous membrane. We look at the mucous membranes to determine dehydration or if there's any problems in the horse. What we want is pink and moist. However, if it's not pink and moist, it could be a fiery red, which could indicate infection, a blue or purple, which would indicate a lack of oxygen, yellow, which would indicate jaundice, a pale, which would indicate anemia or shock, or if it was dry, it would be dehydration. To look at the mucous membrane, I'm going to come over to Butters, and I'm going to look at the upper lip, and then what we want is for it to be pink and moist in his art, and that means he is normal. The next horse health check that we have is the capillary refill time. What we use the capillary refill time for is to see if the horse is dehydrated. Now what we do is we're going to come back over here to Butters, and what we want is pink and moist. So I'm going to lift the upper lip, and I'm going to place my thumb on the gum and wait till it turns white. And when it comes off, I'm going to wait for it to turn pink and moist again, and that should happen between 1 to 2 seconds. If it does not, the horse could be dehydrated, and we'll move further into more problems. The next horse health check I'll be demonstrating is the skin pliability or the skin pinch test. We use this test to see if the horse is dehydrated or not. Where we do this is on the neck of the triangle right here. And what I'm going to do is I'm just going to grab a piece of skin and I'm going to lift up and then I'm going to let it go. And in 1 to 2 seconds, it should return to normal. However, if it doesn't, you should take into consideration if the horse is older, because that plays a big part in it. So I'm going to come over to Butters, piece of skin, and it returns in 1 to 2 seconds. So Butters is normal. The next health check I'll be demonstrating is the respiratory rate. We do the respiratory rate to look and see for the overall health of the horse or if there are any issues. The normal respiratory rate for a horse is 8 to 16 breaths per minute. If it is higher than that, it can indicate pain, stress, exercise. If it is lower than that, however, it can indicate shock. We do this by looking at the flank, standing right at the heart girth, and every time the flank goes up and then down is 1 second, or is 1 beat, or is 1 breath, excuse me. And so I'm going to help, you can do it for 15 or 10 seconds, however, I'm going to have my holder time me for 10 seconds. Alright, so I'm going to stand near the heart girth, and if my handler is ready, I'm going to have her ask time for 10 seconds. Ready? Ready? Yep. Okay. In those 10 seconds, I saw 2 breaths, and 2 times 6 is 12. However, If the respiratory rate is higher than the heart rate, that's called inverted respiratory rate, and that is very, very bad, and you should contact your vet immediately. And Butter's is normal.